Hi, everyone, and thank you for coming to the information session on healthcare recruitment. I'm hoping this is a career that you decide on. A lot of people are loving it and having fun doing it. So, Girl Friday, I am Sakina. I have been running Girl Friday since 2011, and I love helping people make a living from home. And this is with our Girl Friday healthcare and contact center, and then our at-home business system. So what is a healthcare recruiter? A healthcare recruiter, it's the best way to say it, it's a matchmaker. That you are a matchmaker. You are finding the right hospital for the right healthcare professional, and you're matching them together. So you help the workforce and then help people find the right company that fits their life and fits that company. So you're helping people find the perfect job, and then you're helping the company find the perfect people. You get to go ahead and then work from home. We've been telecommuting since 2011. So way before the pandemic, way before it was super popular. We have always had people being able to work from home since 2011. We have helped over 800 people make a living from home since 2011. That's a lot of people. I'm excited to hit the 1,000 mark, but we have helped over 800 people make a living from home. These are not the people that we place, because the people that we place do not work from home. They work in hospitals, clinics, facilities, things like that. But these are the people that have worked for Girl Friday since 2011. So why Girl Friday? It's because we care. I know a lot of companies say they care, but then they treat you like a number. That is not what we do. You can talk to a lot of people that worked for Girl Friday or still work for Girl Friday. I do not believe in treating people like a number. The reason why I started Girl Friday is because I was treated like a number. I worked for a call center way back in the day. My son had an emergency. He was swelling up, and they were sending my son to the emergency room. They contacted me. I answered the phone, and I said I had to go, and my supervisor pulled me to the side and said, I need to figure out what's more important. Like, I need to figure out where my priorities were. And I'm like, my kid is my priority. I wouldn't be working here probably if it wasn't for my child. So it was a mixture of that, a mixture of being in the military and then coming out of the military, and then friends getting out of the military and then unable to work, where people were around them, walking around them, making noises. So then they can be able to work from home. Being able to help single parents that had latchkey kids. I was a latchkey kid growing up with the key around my neck, letting myself in, and then going to nursing school for my RN, and putting those mixtures together and figured out what I really, really wanted to do. I went to school for business because I thought I wanted to open up a clinic and then be a nurse practitioner at the same time. Life changes. I wanted to be with my children more. I wanted to be able to live life a little bit better. So this was the perfect job for me. And I still call it a job, but it is my passion. I've been doing it for over 10 years now, and I still love it like day one. I still have my bad days, but I still love it like day one. So I believe in rewarding people that are doing well. Rewarding people in some cases are money. Sometimes it's prizes. Sometimes it's recognition. Sometimes it's trips. Sometimes it's vacations. Whatever it is, I believe in rewarding people, because without the people working, I would not have a business. I could contract with businesses every day. I could have 100 contracts with businesses. But if I didn't have people that were filling those contracts, I would not have a business. So I want to, in the best of my abilities, to be able to show how much I appreciate everyone that is here and working. And one of the ways is making sure that everybody's able to work from home too. And being able to be there with your family, loved ones, whatever the case is, or Some people that have disabilities are unable to leave the house. So working with everyone for whatever your needs are that you need to work from home. And then you have a career. We have the Girl Friday Healthcare. We have Girl Friday Medical Billing and Coding. We have Girl Friday Contact Center. So you can move up within the company: supervisor, team lead, manager, HR, sales. We have so many things that you can move up within the Girl Friday system because we are a corporation. A day in the life of a healthcare recruiter is networking, talking to people. You have to enjoy networking and then matching people up to the right ones, sending out emails, posting jobs in job boards and telling people about positions that we have available, emailing them about those positions, seeing if they're qualified, if they're missing something out of their resume, to talk to them and make sure they have it, talk to them and make sure that they are fitting the right ones, to contact schools because people are coming out of school for nursing, respiratory therapists, physical therapy, whatever it is. They're coming out of school and then they also need jobs too, not only the experienced people. To look at the positions that are in our applicant tracking system. It's normally over 50 jobs that are in the applicant tracking system, but sometimes we have over 200 in there. To match those people up together and then get paid for that, for putting the people in the correct positions. And then we have weekly meetings on Wednesday at 10 a.m. Eastern Standard Time. And that's the time for us to tell about contests, see what's happening with the business, go ahead and give you new skills to be able to become better healthcare recruiters. We have a short series to teach people how to become a healthcare recruiter. It's going to teach you the very basics of it so then you can go ahead and get started in your career as soon as possible. And then we build on that by giving you weekly. Sometimes I won't even have a meeting. I will go ahead and then send you a video or information or an article or best practices to become better at what you're doing. Important is you make a difference. You're making a difference in the healthcare field. Some people are like, oh, I don't want to see blood. I don't want to see gore. I don't want to see that kind of stuff. But I want to work in the healthcare profession. This is a great one to go ahead and then work in the healthcare profession and being part of the healthcare without going into the office or having to see patients. You're able to go ahead and spend time with your family. If you have a computer and an internet, you're able to work from home. You're able to work the hours that best fit your situation in your life. And you're in control of how much money you make because we tell you how much money everything is for every position that is filled, and you determine what you're going to do. The details is that you do pay for your own applicant tracking system to have access to it, and then you pay for your business email address. And these two total $25 per month. I believe that you have to have skin in the game. If we're paying for your applicant tracking system, we're paying for your email, what's guaranteeing that you're going out and you're being proactive and you're actually searching for people to fill those positions? Or are we just paying for you to sit there and no one else is doing anything? And then this is not necessary, but you can have a phone system for $30 a month, but you can use your own cell phone. Some people like to use the cell phone, the business phone line that we have that is actually through Nextiva, because then they can give out their 800 number, they have their extension, they have a automated system, they're able to look for them through the name directory, they're able to punch in the extension. It just looks more professional, but it's up to you on how you want to do it. So the details on pay is this is a commission-based one. This is a contractor position. I do not take out taxes for you. If I say that the payout is $2,000, we're going to pay you $2,000. I don't take out anything from that. So it is commission based. Most of them, so it can be anywhere between $1,000 to $10,000 per person that is hired. It is higher. I think the lowest one that I saw out of the 225 positions was 15 of them was between 500 and 1,000, and then all the rest of them from that was at $1,000 and above. So that's over 200 positions that are paying at least $1,000 for each one that is filled. The average pay per position is going to be anywhere between $1,000 and $4,500. That's the average. We do have ones that are a lot higher, but this is the average that I normally see. And when I looked today, it was actually between $2,000 and $4,500. The payout is going to be 10 days to 40 days from the time of hire. And it just depends on the position. If it's a short-term position, you're going to get paid within 5 to 10 days from the time that they start. And then if it's a longer term one, it's going to be anywhere between normally 15 to 30 days before we get paid out. And then we pay you out within 5 days from that. This is a contractor position. Once again, we don't take out any taxes for you. You have to pay Uncle Sam yourself. We do pay through direct deposit only. The average pay that people are getting paid is between $51,800 to $67,000 per year. The lowest person that we've had that got paid for 2021 is $32,840. And then our highest for last year was $135,894 for the year. So the next step, if you want to go ahead and then move forward, is the training is self-paced. So you can do this at any time. We used to do live trainings. I do not do those anymore. This way you can start when you want to. Send me an email to sjohnson@sakina.com or sakina@girlfridayhealthcare.com. If you have any questions, feel free to contact me Monday through Saturday, 8 a.m. into 2 p.m. Eastern Standard Time. And that's through the email, or you can give me a call at 678-885-9992. Once again, that is 678-885-9992. Tell me that you will go ahead and like to move forward, or go ahead and then click the link, because some people I have already talked to, I just needed to give you guys the information for the information session and then told you guys to listen to this. And then you can go ahead and then click the link to move forward. That's going to put you into the membership that's going to have the training, and then the direct deposit information, the 1099 information, and then the information for the monthly of the $25 per month. If you have any questions, please feel free to contact me. I hope to see you part of the Girl Friday family, and I will talk to you.